been out by you, but this is the second weekend in a row, nonstop rain, like 4 days in a row, all
I'm
day.
I'm in
Like,
Phoenix, so it's dry, dry, dry.
yeah. I just visited Sedona for the first time in April. Oh my God, I want to retire there.
It's so beautiful.
It is. It is. Landed in Phoenix, and what? And you know, it's so funny. I was going to take pictures of the cacti, and I
Uh-huh.
was like, oh, I'll just do it when I get to Sedona. And I'm like, they have completely different
Yeah,
cacti there, so I
yeah.
never got pictures.
It's changed. Uh-huh.
Yes,
Mm-hmm.
because of the weather. It was so so cool. Anyhow, all right. Just because with all the craziness of today, let's go ahead and get started. So, Dr. Costales, I'm so excited to connect with you today. There are a lot of hard mental health topics these days that we really need to be talking about. And here at Fempower Health, we don't hold back on anything. And I think it's so important to create awareness of what people are going through when they're struggling. And I think with the maternal health crisis in our country, I think this is such a important topic, which is postpartum depression and postpartum psychosis. And until you all reached out, I didn't even know there was a difference. And so I'm very intrigued and excited to spread awareness. And so before we dive into questions, I'd love to get your background and talk to us about like your background personally, professionally, and also even how you became so passionate about this specific topic.
Absolutely. So, I'm Dr. Theresa Costales. I'm a board certified psychiatrist. I'm currently serving as the Arizona Medical Director for Connections Health Solutions. We are a provider of crisis behavioral health care. So I oversee two crisis facilities, one in Phoenix and one in Tucson. We are a no wrong door organization. And what that means is that anybody experiencing any sort of mental health crisis, whether it's because of an acute stressor, because of an exacerbation of an underlying illness, because of a new illness developing, or because of a crisis caused by substance abuse, they are welcome here. We take them in, we assess, we treat, and get them the resources they need and get them to the level of care that they need to be at. So we serve anybody who comes in that door.
Oh, that's so important because I know a lot of people between shame um, and maybe being so stuck they don't even know where to reach out or how, and probably a million other reasons that we may not even be aware of. So it's great that you have such a resource.
Yeah, access to care is so important. Um, it's hard enough for people to reach out, and especially when a part of the illness is not recognizing that you have an illness,
Mm-hmm.
for the community to understand where their resources are, where they can take someone and not have to jump through a bunch of hoops and go through red tape and wait for months to get in to see someone, to have immediate access to high quality mental health care is rare, too rare, and very, very necessary in all of our
Yeah,
communities.
no, absolutely. And a one of the things that it's funny, I feel like I have to just ask this because it's going to be on people's minds, and then we can dive into specifically postpartum depression and postpartum psychosis. And so I like to just go with the flow of where the conversation's at, if that's
Sure.
okay. Access to care. So, I know I have an 8-year-old, and I know that with COVID and whatnot, it was impossible to find a therapist, and it was like urgent. It was to the point where we just got someone to have anyone, and that wasn't effective because and we noticed because he resisted, but we needed something. And I'm just curious, like when people reach out, like how, I guess, talk to us about access, because this is not about just reaching out to your center. I think this is a general access question. And so for someone who is really struggling and they're like, I don't even want to hear about postpartum psychosis and postpartum depression, I'm talking about access first. So let's just address it and then we can dive in.
Hmm. So I think that one of the big, huge barriers to immediate access to care, or maybe access altogether, is that mental health systems tend to be really complicated. Whether you're voluntary, whether you're not voluntary for treatment, and there has to be some sort of forced treatment, whether you need access to medication management, evaluations, therapy, referrals to primary care, referrals to neurology. What type of insurance do you have, like dictates where you can go. Because the systems are so complicated, it's almost impossible for somebody out there in the community to just know how to navigate that coming into it. And so it's a huge deterrent to finding the care that you need. So our company is called Connections, and that's really what we do. I see all points of the mental health system intersecting at us, and we have this high level view of the entire system and how all of the pieces connect. And we're able to help people navigate, help individuals, families, other supports navigate that system, walk them through it, bring them to appointments sometimes. And having that service for the community makes all the difference in the world. Because if you, let's say you find a therapist and eventually find a therapist who takes your insurance and then it's not working, well, now what?
Mm-hmm.
I mean, you're going to be left without for who knows how long. Where do you start with looking for somebody new? Where can you go? We help with all of that.
Okay. No, and I can actually relate so much to this because I remember going through, I was in kind of a crisis situation, and I was also in a new city, and I was in a new state as well. So I had to get a new therapist, and every single person I called either wasn't taking insurance or wasn't taking new patients. This is pre-COVID, by the way.
Yeah.
And and then anyone that was on my insurance plan, like it wasn't even clear on the insurance plan who I could even pick. And I have a healthcare background, by the way. And I was like, I don't even understand any of this. And so I had to literally go through the modern version of a phone book. Okay, so let's start from A and go down to Z. And no one answered. I had to leave messages. I would tell them, I'm begging you to call me, even if you don't have space, so that I know what's going on and that you got my message. Like, it was awful. And you're a mom
in crisis.
Right. And I was in crisis, and I was just like, so then it made it worse because I'm like crying on the phone, like, please, I need help so badly. Please call me. Yeah. It's rough. So let's talk about postpartum depression and postpartum psychosis. I mean, there was even a recent story of the mother who ended up jumping out of the second story window, who had killed her children, which is devastating. So I'm assuming that's probably the postpartum psychosis end. I'm making an assumption here of what this is, but I assume that's probably one of the more extreme cases. So can you just, I don't know, maybe give us some background on, I'm a woman, I've just had a kid. What happens? And let's walk us through that journey.
I will say I am a mother of two myself. So right now I have a 2-year-old and a 5-year-old. So these are things, and I'm going to pepper in some of my experience as we walk through that journey, because no one prepares you for how difficult it's going to be. When I had my first child, my daughter, my parents were there to support me. I was already a psychiatrist. I had finished my residency, was in fellowship. I knew all about baby blues. I knew all about postpartum depression. I had no history of depression or anxiety. I was doing pretty well. I had a lot of protective factors. And after I had my daughter, I can remember maybe about a week or two in, every afternoon I started to feel this overwhelming sense of dread, anxiety, tearfulness. I didn't know what I was worried about, but I was worried. I was terrified. I was sad. And I recognized this must be baby blues with a hefty anxiety component. I could intellectually say that because I'm a psychiatrist, because I had taken an interest in reproductive psychiatry, even back in residency. And I had been to all the journal clubs. I had treated women with postpartum depression and postpartum psychosis. I knew what this was,
Mm-hmm.
and I still couldn't think my way out of it. So what was happening to me was that I had just given birth, meaning I had crazy hormonal fluctuations happening. I was breastfeeding or struggling through breastfeeding for the first time, trying to get my baby to latch, trying to figure out why she was up crying all night. When I changed her, I'd rocked her, I'd fed her. And every time I would feed her, then, I was sore. At one point, your nipples are bleeding and you have to keep nursing. I had a doula, I had a lactation consultant, I had all the support, and it was still really, really hard. I remember crying, breastfeeding her up all night and feeling incredibly, incredibly alone, even though I had some support around me. At the end of the day, I'm still responsible for this tiny, very fragile human who I just carried for 9 months and waited for. And that was really overwhelming. So I had baby blues, and it lasted for maybe a week and a half, 2 weeks, and then it resolved. I was worried at that time that what was starting to happen was postpartum depression, because once it becomes postpartum depression, and again, I knew as a psychiatrist what the possibility was, and I still was like, I can do this. It's going to work out. This is going to be over with. And I had not reached out. I had not reached out to any of the psychiatrists I knew, to a therapist. I was like, I'm going to be okay. I can do this. I don't need anybody else right now, even though it felt so intolerable every day for a period of hours, just crying. And I was fortunate that it ended. I was fortunate that it was just baby blues. And even now, though, that was emotionally very difficult to deal with. That was a very brief period. And, when you have babies, it all starts to blend together.
Right.
For a while, right? But I remember the feeling very distinctly of that period where I had baby blues. And there, no amount of support around me and my family could help at that point. Postpartum depression will last for much longer, much more consistently. I was feeling like that way for a few hours every day, maybe 5 hours a day. Postpartum depression, depressed mood or irritability, kind of mood swings, the crying, withdrawal, which makes things especially difficult because at the time you need help most, your illness is making you withdraw. Loss of
What about feeling disconnected from your child as well? When you said withdrawal, yeah.
Yeah. So it's not just from your supports, it's also from the baby. So it very much interrupts your bonding with your baby when you're feeling that way, when you are getting depressed or in full-blown depression. Your ability to connect is impaired,
Okay.
which is tragic. That's a very difficult thing to get through. So it's all the symptoms of a depressive episode, only it's while you have a newborn,
Yep.
which is like, I mean, how are you supposed to cope with that on
Right.
your own? And so we started talking about access to care. Immediate access to care when this begins happening is incredibly important to help mitigate those symptoms, prevent progression of the illness. And when I say prevent progression of the illness, I mean, it can feel really bad to be depressed, to be sad, to not be eating. But eventually, this often progresses to thoughts of wanting to die, and then thoughts of wanting to kill yourself because you just want to end the pain. And depression is a disease of cognitive distortions. So you see things, you see the world, you interpret every interaction you have through this lens of depression. And it twists the way you understand how others are seeing you and how the world appears, and you begin to think differently. And so that despair that results from these cognitive distortions is enough to drive a lot of people to attempt to kill themselves. And this is a treatable illness. This is a treatable illness. This is an episode, although it doesn't feel like it at the time. It feels like this is it. This is it now. This is how I am. And you can't think your way out of it. And it requires treatment. But if you get early treatment, you get therapy, you get the support of friends and family who come in and help you with baby. Because again, very overwhelming to take care of a newborn. Very overwhelming to take care of a newborn.
No, absolutely. I can empathize so much with your experience, and I would love to talk about, because I think examples help. I actually recently interviewed an expert on OCD, which was absolutely fascinating.
Oh, that's
because
one of my too.
Yeah. Okay. Yeah. So she talked about postpartum OCD. And so, at the end of the day, like, as a person, we don't necessarily, before we go to the doctor, have to have it diagnosed. I think that's for our doctor to, but like but generally speaking, I think having examples is really important. Like for me, I had the same situation. My son's now 8, and I went through 4 years of fertility treatments and then had him. And I was a high risk person for postpartum depression. And I don't know if they were just being proactive or like there was something specific about me. It doesn't really matter, because at the end of the day, it was about making sure that I was able to be there for my son. But I remember every OBGYN appointment, they would do the checklist, they would educate me about it. And they gave the checklist to my husband. And there was like this whole community. It was in Chapel Hill, North Carolina. And there was a birthing center there. There was like, breastfeeding groups, like doula, you name it. It was such an amazing community. And it helped because when my son was born, and now there's so much we know that it's a shame the pediatricians didn't catch. And we are now 8 years later, finally solving them, which is irritating. And that's a whole other discussion. But, and again, this is not to blame pediatricians. Healthcare is so complicated. So when I said pediatricians, I did not do it to place blame.
You're still allowed to be frustrated, no matter what.
Exactly. But anyway, so I had a really hard time breastfeeding. I was that mom that made the cookies. I got so sick of making them, I bought them, or at least I bought the recipe where I just dumped in the liquid ingredients, made the cookies, made the smoothies. Yeah, made the smoothies. Like everything I ate had the ingredients, and it was still hard. But by the way, I have to say at the end of it all, I actually had milk left when I was done breastfeeding. I was like, how did that happen? Because I literally hardly made any.
All that liquid gold. Oh yeah. Proud of that.
But I did. So it was such a hard time that there was a situation where my ex had to hold this syringe while I was, it was so complicated. It was like, it took basically all of us, my baby, me, and my ex, all working together to get my kid to nurse. And it had to do something with, I had to nurse before he woke up, and that milk would be put in with a syringe into his mouth to get him interested in suckling while we put an ice pack on his back because he was sleeping and wouldn't wake up to nurse. And then he would finally nurse. And then it was, I have to do this in 2 hours because as you know, the clock starts when you start nursing, not when you're done. And he barely nursed. I didn't produce milk fast enough. So I wasn't sleeping. And so I got to this point where, and I'm so grateful that they said, anything that happens is okay. Talk to us. And because I had that, I remember I'm holding him. This is the kid I spent 4 years of appointments and being stabbed and medications and whatnot to have him. I'm holding him. And every time I walked near a door, I said to people, I'm like, I don't even know how to explain this. I'm like, it was this like fantasy fear.
But just to your brain, right?
Yeah. Oh yeah. And I'm like, I love this kid, but I'm like, fantasy fear of like bumping into the door with his head. And I'm like, this is so messed up. And I finally just said something and they're like, it's okay. And then I was on a mandatory sleep. So it was, you feed him, you go to sleep. There is no dishes. There is no cooking. There is no nothing. You sleep. That is all you are allowed to do is feed, sleep, feed, sleep. And I did that. Luckily, it was just a few days. But wow, was that scary. Oh my gosh.
And it hits you out of nowhere. And you're like, is this coming from my brain?
Yeah.
I mean, So talking about postpartum OCD, it's another very fascinating topic and something that I've had the chance to treat before. And a lot of women will have very mild symptoms of OCD going back many, many years, even to childhood sometimes. And you can see kind of the predisposition, but it never really manifests into like full clinical disorder, right?
Okay.
It never really impacted their functioning, but you can see some of the stuff going back as you ask, as you dig into like do those formal assessments, like a Y box. And then there are these remarkable changes in a woman's brain that occur when she gives birth, that you can see on functional neuroimaging when you take fMRIs of a postpartum woman's brain and you compare it to how her brain was before. You see these changes in uptake that are occurring. And one of the big effects is a massive increase in your empathy, which facilitates bonding. It facilitates all of those warm maternal feelings manifesting in nurturing of this little human that you are wholly responsible for keeping alive. But the flip side of that is that it can make you very overwhelmed with emotion and anxious. So the example I like to give of that is, again, it's a personal one. I'm a big true crime, thriller, horror movie kind of person and always have been. And I can remember that right after I had my daughter, my parents were watching some TV show that wasn't even like that scary. But it was this like scary monster thing was out in the like frozen tundra, and it was like chasing these guys and they couldn't really see it. And, they were dying from all sorts of weird illnesses and it wasn't that exciting. But I remember coming into the room and watching this for a minute and feeling all of the dread that someone would feel if they were really alone out there and being chased by some mysterious, scary creature that they couldn't see. And I took on all of that in a way that I never had before and ended up almost yelling, "You have to turn this off. You have to turn this off. Like I can't even watch this right now." And they were like, "What is going on with you?" And that's a very typical change that happens in a woman's brain after she gives birth, regardless of whether you have a history of OCD, depression, anxiety, regardless of whether you're experiencing baby blues or postpartum depression, that is a normal change.
Okay.
Which is wild. It's wild that your brain changes when you give birth. And those changes persist. We don't know how long they persist for, but they persist for years, for a long time. That you're going to be different after you have a baby.
We're talking so much more about postpartum depression at the very least. I know we're also going to talk a little bit about the postpartum psychosis, which I assume all of this is on a bit of a spectrum, but it seems like we're talking about it a lot more, right? And I can imagine that the prevalence is probably increasing, I'm guessing, even though women's brains change, when they do have a child. I can imagine that there's, things like loneliness and whatnot. But I'm so curious, just over time, this is not something that I was really aware of. And honestly, the first time I heard about it was when Brooke Shields wrote her book. So just out of curiosity, are we seeing more of it? And is there something contributing to that? Or is it that we're just more aware? And are you seeing it increase post-COVID, increased loneliness society?
So I think it's, impossible to tell for sure, but it's very likely all of the above. It's
Okay.
always been there to some extent in our society. It's better recognized now. We're talking about it more now. And human beings are by nature tribal. And we evolved raising our babies and children in these communities where there was a lot of support constantly. And I even began imagining that when I had my daughter and felt so isolated. And I was living in a city that was like relatively new for me. I had trained and grown up in New York. And then I was in Seattle and I had been there a couple months when I got pregnant. So it was still a relatively new city for me. I had my parents there, but I still felt really isolated and lonely. And I felt like I would really have benefited from having a tribe around me. And I think that as society has progressed in the way that it has, even though we are constantly talking to each other in some way on social media, and having those exchanges, it's not the same as having that community around you. So I think that is contributing. I think that people being at home more, even post-pandemic, is probably contributing as well. I know I don't do great working from home.
Right.
I just don't. I do a lot better coming into an office at least a few days a week, and having that community in a healthy place, which
Right.
I'm very lucky. I work in a very healthy work environment with people who we're all on mission together, and we have a great time at work. But I think to some extent that was true even when I worked at places that wasn't as supportive. There was something about being around other humans.
So it sounds like, when going through this major change in life, it's like, even with my story, it's like really set yourself up and be prepared almost, not necessarily in like a hyper way.
Right.
Because like you're saying here, like it was funny, I had an opposite situation. So my
Mhm.
mother passed away when I was in my early 30s. And I was in a new state, not near any family. I left where all my friends were when I was 6 months pregnant. So I didn't even have my friends. But I had to create the community. And so it was like the community I designed. So I actually think that helped me. I'm curious because, and this might be helpful because I think rare is my situation. I think most people have like the friends and family around them, at least if they fly in, they may not be living near them. So I'm curious about this dynamic of community. Is it where one of the preparations is, even though we may have friends and family staying with us or helping, it almost seems like having a separate, like, people like me, people who are in my shoes community. So it's a safe space to be able to talk, because I can imagine the filter, because with family members, it's probably, this is what you should do. This is how you should do it. And you're already stressed out and everyone's like telling you the way to do it. And so you don't even get to breathe. And I'm sure that's added pressure. So do you advise that's like would that be like a key way to get through this tough time?
I would say especially, for any postpartum period, but especially if you're having baby blues or beginning to experience postpartum depression, yes, having a group of people who are in a similar situation to you, who you can just be with and relax, and let your guard down, and maybe vent about those family members who are telling you these wackadoo things to do sometimes that like they learned was the thing you're supposed to do, but you're like, oh my God, how did we survive? Having that group is very important. And so you were talking about being in Chapel Hill.
Chapel Hill, yep.
In Seattle, they did this. I did centering pregnancy. So it was, I went to my appointments. They were group appointments. So they were, a bunch of different couples. We were all due within 4 weeks of each other. And it was incredibly supportive, and, we all learned together, and a lot of people ask questions that you wouldn't even think to ask. And so you end up having these conversations that you wouldn't, and then you form this little group, right? So I still have a chat, like a group text and we have moved all over the country since then, but I still have this group chat with these women, and we all had babies within 4 weeks of each other. And, we had our initial postpartum visits together, where we brought the babies in. And that provided so much relief for me. Those were really good days when I was able to be with that group of women and their babies. Yeah.
That's so nice. Now, I do have to call out, just given access to care. So let's face it, you and I were able to afford doulas. I had a postpartum doula, a birth doula, who unfortunately missed my pregnancy because I basically woke up and I was like, it's time, and almost gave birth in the hospital lobby. So my doula, she actually, can I tell you,
deliveries. Yep.
Yeah. It's what's funny is she walked by the room because they told her the room number, and she heard a baby crying. She's like, there's no way that's Georgie. And she kept walking, and she was like, wait, what?
The baby's out already?
She missed the whole thing. She was on the phone with us when she told me it was time to go to the hospital, but it's like, we can't count contractions because they just won't stop coming.
That's right.
It was very painful. But nonetheless, like, and being able to afford that, unfortunately, in this country, we don't have such proactive healthcare system. Yeah. And so there's all these wonderful things. I mean, yes, we can find the friends, we can do all these things, but like, maybe we should start with the realistic ways that people can find support. You had mentioned people being able to contact you, and what does that mean financially? So maybe we start with the basics of, I do not have the money to pay for all these quote unquote fancy things, even though they shouldn't be fancy. They should be foundations. What would they do?
And I do think there are programs in some areas, probably especially in cities, where women are able to have access to a doula, and often have access to a doula who is of the same race or ethnic background, which
Okay.
is super important too, or it can be for a lot of women. So I think that outside of having immediate access to all of these incredible resources, doing what you did, which was building a group of people around you when you can, and forming real life relationships with people who you get along with, who you can trust and lean on for support, is also incredibly important. I think if we also, as professionals and people who advocate for better, higher quality care, especially for women, if we raise the alarms and advocate for the formation of these programs, I think that can have a big impact on whole communities.
Right.
I think education on, like you were talking about, going to your appointments and having your OBGYN go through these symptoms with you, and then educating your partner on the same topics can have a huge, huge impact. So I'm hoping that as I go out there and I talk about postpartum depression, postpartum psychosis, and I think OBGYNs are really very much on board with every OBGYN I've ever met has been very much on board with having this education, having this knowledge, and then passing that knowledge and understanding along during appointments can have a huge, huge impact. Because if you don't know what to look out for, you're not going to know what's hitting you. You're
Right.
not going to know what to do. It's going to be very confusing, very confusing. And then if the primary care providers, OBGYNs, have some working knowledge of their local mental health system, being able to provide those resources to patients during their routine appointments is also huge. Connections is not in every city. We are expanding and looking to go other places. We talk about our model. We do consultant work and help other communities develop the type of crisis system that we have been able to develop here in Arizona. Just knowing what those resources are, though, I think is a really important function of primary care, including OBGYNs.
Yeah, no, absolutely. So I'm in a crisis. I don't know. This is so hard, right? Because when you're in it, you don't always know.
No.
So, it's like, I feel like I want to promote this podcast to family members as well as the women, because
Yes,
it's hard because, so I guess to the family members, let's talk about this. A lot of people say, I don't want to pry.
mm-hmm.
And I'm just going to give an example of when I was in North Carolina. I met this woman at the gym. And when she heard I was from New York City, because she was from New York City, she like ran into me, was like, I need your number. And I had my son, and she shows up with food and balloons. And I'm like, who is this person? And she just was like, here you go. And then she would like force me to go for walks. She would like show up at my house. We're going for a walk. And I'm like, but it's so hard to leave the house. It was overwhelming. I remember that first time. It's like, it's just a baby. Oh no. It felt like I was like, how do you leave? I don't know how you leave. What do you pack?
What are you talking about?
But like, I'm so grateful for her, because it's like, I barely knew her. I had my kid 3 months after I moved there. And she was just like this person who was like, okay, here I am. And this is what you're going to do. And I'm so grateful for her, actually.
Yeah. She was just what you needed, right? Yeah.
And I didn't even know I needed it.
No.
But nonetheless, I think I hear more often than not, I don't want to pry. So help those who are, because again, the women may not call. They may be so depressed, they may not know.
So as a general tip, when women are starting to even hint at they're struggling, they have been struggling for real for some time. And they may not have the words to tell you. They may be a little embarrassed and doing all of that self-talk that we tend to do. I can handle this. I can do this. I don't need help. I'm strong. I'm not weak. If you are seeing these signs leak through in your interactions with a woman in your life, especially if she's just had a baby, please pry. She is in need of help. And she may not be overtly asking for it, but she's asking for it.
How does one pry? What do you do? What's like, it can't be, like, how would you even do that? I wouldn't even know the approach, because I find even friends not going through this, can I help? No. And then I find out later that they can't function at all. And I'm like, and I keep saying, how can I help? And there's no.
Yeah. So it's going to be a little different for every person, how you approach it. And you might have to try a couple of different ways because everybody's a little different. But I think showing up is a huge, huge part of beginning to pry. Just being there, not asking, how can I help? An image that I like that comes to mind during this conversation is if you come across a person who's hanging on to a cliff by their fingernails, and you come along and you extend your arm and you say, I'll help you, take my arm. They can't reach out for help even. They are tapped out. Everything in them is holding on to that cliff. And you have to reach down and pick them up. Because too often people reach out their arm, and when the person doesn't take it, then they walk away and say they didn't really want any help. It's not true. What your friend did, like telling you we're going out, come on, this is what we're doing. Or, hey, I got this, baby. You get up and you go take a shower. You remember what taking a shower was like when you had a newborn? That moment that you had to have a shower? You have to just jump in.
I will. Can I just give this one little example? Like, I almost brings tears to my eyes. I have a friend who recently had a baby, and when I had my doula, you know what she would do? She would get a big pot, boil water with Epsom salt and lavender. She would dip the towel in it and put it around my neck. And my friend, I went to go see her. The baby was 9 days old, and I could just tell she was holding it back, but she was trying to be, I don't know. And I know her well, but it's not like I've known her for 40 years. I've known her for like 3.
Yeah.
And there was just this look, and she wouldn't let me help. I tried, and I was just like, I told her husband, go boil some water. Where are your pots? And I was like, where's your Epsom salt? Do you have any? Do you have any lavender? Anything, just anything. Trust me, we're going to do this. And I just made this thing for her. And I just like, okay, you're going to move, and I'm going to put this on your shoulders, and you're just going to sit here and relax. Mm-hmm. And do you need tea? Like, it wasn't even, what do you need? It was, do you need tea? Do you need water? Do you need food? Are you hungry? Like, I was just being so direct. And she started crying and then she finally let it out that she was struggling. Yeah. And can I just say, I was so uncomfortable because I haven't known her for 20 years. Mm-hmm. But I was just like, I don't even care, because I knew it helped me. And I was like, I'm just going to reach for that simple thing. She can't get pissed. It's going to feel good no matter what, even if she doesn't need it.
That's right.
So can I just say to everyone, just do the towel as an opening.
Yeah. Yeah.
Right? It was so magical.
It's symbolic, right? You are coming in and saying, I am just doing something for you to make you feel better. I'm going to do it for you. Just sit there. Yeah.
Yeah. It's really important. Mm-hmm. So a couple things then. Postpartum depression versus psychosis. What do we need to know?
Okay. people don't talk about postpartum psychosis much. And they often say it in the same breath as postpartum depression. And then say, oh, and then there's this more extreme thing, postpartum psychosis. It is a different thing. And it is a really scary topic. And I think that's why people shy away from it.
Mm-hmm.
And we can't. We can't shy away from it because its outcomes, when not treated, are very tragic for whole families, for whole communities. It has to be talked about. So postpartum psychosis is relatively rare. They say it's like 1 to 2 per 1,000 live births, but so that's happening. It's happening. There are women out there every day who are in episodes of postpartum psychosis. It's rare that I don't have at least one woman who's in one of my Phoenix or Tucson facilities who's experiencing postpartum psychosis at all times. And it's a whole person change that occurs. So instead of just the depression, the mood swings, there are hallucinations, meaning it's usually hearing voices. And it sounds just like any voice talking to you. It uses the exact same pathways in your brain, but there's no one there. Usually scary things those voices are saying. Delusions, which are false beliefs, and they're very much experienced as reality, so you can't like reason or talk somebody out of it. A lot of emotional distress that comes along with it. It's like a confusion, a disconnect from reality. And most often from my experience clinically, the delusions are persecutory in nature, often with like a religious kind of component to them. And they often involve the baby. So like something evil is happening to the baby or is going to happen to the baby. And there is this disorganization of the behavior. So there's bizarre behaviors. She is not acting like herself. And there is a significant risk of infanticide, meaning a mother killing her baby. Not because she doesn't want that baby, not because she thinks that baby has done something, but because the delusion often drives her to conclude that the only way to save the baby or babies is to kill them, which is not logical.
That. Mm-hmm. Right. I have heard that.
It's not logical. It doesn't make sense. But that's psychosis. That's what psychosis does to you.
Is this a sequencing thing? So it may be baby blues. If you don't treat it, it can go to postpartum depression, then can go to postpartum psychosis. Are these different? And I'm not saying every postpartum depression that's not treated goes to postpartum psychosis. I'm not saying that, but is it a graduation or they're completely different?
Different things. At least half of people with postpartum psychosis have just no psychiatric history at all.
Really?
Yeah, absolutely. So this comes out of nowhere. I find that a lot of times the women have some history of trauma that kind of maybe makes the brain more vulnerable to developing postpartum psychosis. A lot of women will go on to be diagnosed with bipolar disorder afterwards, and this is the first manifestation. So there's something about the lack of sleep and the hormonal changes that are occurring at birth that kind of unmask maybe an underlying bipolar disorder. And they won't likely have episodes unless they have another baby of postpartum psychosis. But they will, even between births, then have episodes of mania and need to be on like a mood stabilizer on some sort of continuous basis. And maybe if she had never given birth or never been pregnant, she might not have ever gone on to really develop bipolar disorder. There was something,
Whoa.
some
Okay.
risk, some vulnerability in her brain, in her genetics, that was lying underneath. But there was something about the pregnancy and the birth that unmasked it.
Wow.
So that's a
So
pretty big scenario.
So what, I guess for any of these, I don't know how we discuss the treatment plan, because maybe we just break down like the different options, because we talked a lot about prevention. I think with postpartum psychosis, it seems like it's not like,
So
it's almost like just an awareness of people to watch out for it rather than, okay.
I will say that there's some patterns that you can
Okay.
see to, like typically when you hear about the bad cases, and the bad cases that we hear about are when women attempt to kill their children or they kill their children, right? So I think the first one, maybe in recent, collective memory, that was the big case, was Andrea Yates, right? And she killed, was it 5 children? I think she had she killed them all. And she had postpartum psychosis after previous births. It was not treated. It was not recognized as a significant risk. So you see in the tragic cases, often, not always, but often, there's multiple babies at home, multiple kids in diapers at the same time, which is a very stressful situation regardless. But you see some of that pattern where mom has given birth a lot in the last like 5 years, right?
Right.
And there's repeated. And there's often not a lot of support for her at home. It's often thought she's the mom, this is her job. She's staying at home to take care of all these kids, and she should be able to handle that. I can take like maybe a full day with my 2 and 5-year-olds, but it's a lot.
Mm-hmm.
It's a lot. If I had been left alone at home every day with a newborn when my daughter was 3, and that's just 2 kids, I don't know what would have happened. I mean, so there's
Right.
there's a stressor component to it that's not like really clearly fleshed out. And sometimes it's just going to happen. And sometimes it'll happen after the first birth. Sometimes it'll happen when there's support present. Sometimes it's just going to happen. And so, yes, being aware of what those symptoms are, and the whole family, because again, when you're dealing with psychosis, a key symptom of psychosis is anosognosia. It's an inability to see that you're sick.
Got it.
You can't see it. It's part of the illness. So in those prenatal visits, it's important to talk about this too. I remember even in my centering classes where I was in my group appointments, postpartum psychosis was very glossed over. And I was like, oh, hang on a second. Let's back that up. I was like, postpartum psychosis is a psychiatric emergency. And I can remember the nurse practitioner who was leading the group was like, oh, well, damn. And I was like, okay, I got this. I'm gonna take over your appointment for you real quick, because people need to hear what I'm about to say. It is an emergency when you're recognizing this, because the risk that mother could harm the baby, herself, other children is not insignificant. So if you start to notice that she is seeming confused and disconnected from reality and seems to be responding to internal stimuli, responding to voices that you can't hear, that is an emergency. So that is.
So I'd like to paint the picture though for what happens when the emergency help is sought after. And here's why I asked this.
Mhm.
When I did the OCD interview, she was saying that a lot of OCD people are misdiagnosed and potentially like put in
Yes.
prison and things like that.
Uh-huh.
And I think right now I'm going to be put in a mental ward. I'm going to be taken away from my children. I'm never going to see them again. Like that would be where I could see
Yes.
people going.
Yeah.
So and here's the thing, we can't in this discussion say that will never happen.
No. And
I think it's important.
Yeah.
Right. So I want to educate though on what we should expect.
Absolutely.
And should it happen and someone try to do the wrong thing, what in the heck you advocate for? Because that's what I find in healthcare is like, you need to know what's happening and be educated enough so that you can fight the system and stand up for people who don't understand it. So let's go.
Okay. So here's what's going to happen, or what should happen. Mom and baby should be physically separated right then and there.
Just hearing that.
No, it's hard. It's hard. But I promise you that what's harder is coming out of an episode of postpartum psychosis and then coming to the realization that you've killed your baby.
Yeah.
Because that hurt.
Yeah.
Forever. Right.
Yeah.
So you have to separate them physically. Safe place for the baby. Mom has to go in for treatment. This is not outpatient treatment.
Okay.
This is, you're getting admitted. Okay. And that's the safest thing to do in this situation.
And I appreciate you being honest and straight, because we have to be.
and I will tell you that sometimes families will fight. They'll bring her in. And then when I say I'm admitting her, often involuntarily, the families will sometimes fight tooth and nail to get her out. And it will be a battle. And I think one of the things that happens with families and mental illness is that whereas it feels very much like you're advocating for the person, you are inadvertently colluding with the mental illness. The mental illness wants to take you. It's going to walk with your legs and talk with your mouth, but its goal is to harm you, harm others, and thereby harm you. Right? So it's not her that you're dealing with right now. And when you're advocating for taking someone out of treatment that they need for whatever reason, because she's begging you and you feel really bad, it's not fun. It's not like this warm, fuzzy thing that happens when you come into an inpatient psych unit suffering from postpartum psychosis. You don't want to be there. You don't think you need to be there. It's scary. And it's necessary. Not forever. We're not doing that anymore. I think we've learned some of those lessons over the years, that you shouldn't house people in state psychiatric hospitals for the rest of their lives, for the most part.
What could the journey look like? Like, how long might it be?
I would anticipate it being probably a couple weeks.
Oh, so it's not like years or months necessarily.
It's not years. It could be months. It could be a couple months. Okay. But it's until the symptoms attenuate to a point that you can be discharged with then an outpatient level of care. A couple weeks.
Oh, so it's more just so it seems like it's stabilizing the
acute symptoms. Yeah. So it's getting you out of the episode. So part of that, and this is something that I have to explain to people too, we start medications, and the name of the game when you're dealing with postpartum psychosis and or a manic episode of bipolar disorder is get them to sleep, right? So they're not sleeping. So you have to sedate them. And I say, they come in, they're like, oh my God, my loved one, they look so sedated. I don't want them to leave here looking like a zombie. I'm like, I get what you're saying. I have to kind of snow them a little bit right now in this setting where I can monitor them and make sure that they're safe. So I can pull them out of this episode, and then we're going to gradually back off. So yes, they're going to look like a zombie a little bit at first. If you don't want them there for the next 6 months trying to get this under control, that's what's kind of necessary. So you get them medicated, you get it treated, and then you can continue hopefully outpatient level of care. So it's not going to be forever.
Can I ask a really, I'm known for asking the hard questions. This is like hard, awkward, but it's like, you got to bring it on, right?
Yeah.
Are they allowed to have more kids? Is a recommendation not to have more children, or is it be proactive and be prepared?
Be proactive and be prepared. You can absolutely have more children. That might mean start, if you're not already continuing medication during pregnancy with the help of a reproductive psychiatrist weighing in, that might mean starting medications before you give birth in anticipation of this being a potential, or having very frequent postpartum visits with your reproductive psychiatrist. Everybody has to be aware, cognizant of the warning signs. As soon as she starts to say this one thing, we can tell it's starting to happen. And then maybe you need to up your Seroquel a little bit, right? And that's a call to the psychiatrist. And hey, I think it's starting to happen. Let's get on top of this, right? That is very possible, but you can't ignore it. You can't have that episode end and then be like, nope, that's never going to happen to me again. Nope, you are at risk of that happening to you again.
Okay. Wow. That is, so I learned something, I've learned a lot today, but reproductive psychiatrist. Mm-hmm. So this is one thing that's also fascinating to me, is the number of subspecialties there are that we aren't even aware of. How does one find a reproductive psychiatrist?
So they're out there. I would say most of them are probably in major cities.
I know.
Like a lot of I trained in New York City. So a lot of the reproductive psychiatrists I knew were in New York City. And there aren't a ton of psychiatrists, and certainly not a ton of reproductive psychiatrists, but what reproductive psychiatrists do to kind of expand their influence is they provide a lot of free consultation to people who aren't reproductive psychiatrists. So, yes. So, Massachusetts General Hospital, MGH, has a, let me get the name of it so I don't mess it up. It's like a consultation line that's run by, it's the perinatal psychiatric consult line. That's run by Postpartum Support International. It's a free service. It's staffed by volunteer reproductive psychiatrists. They provide guidance to medical professionals who have questions about any psychiatric care of pregnant, postpartum patients, or some of the unique hormonal conditions that we run into. They are expert in all of that, and it is really easily accessible to any healthcare professional. So getting expert advice is like a phone call away, or it's like,
wow,
like go to their website and fill out like a really quick form, and then you get a call, right? It's easy to access. And then I think it is the responsibility of all psychiatrists who are practicing in the community to apprise themselves of this knowledge, right? That you have to be aware. You might not be a specialist. You might have to reach out to one of those reproductive psychiatrists on the perinatal psychiatric consult line from time to time, but it is every psychiatrist's responsibility to understand and be able to educate their patients and be able to diagnose accurately what these disorders are, And I mentioned MGH earlier. They have this a whole series of continuing medical education modules on perinatal psychiatry. They have a website, their Psychiatry Academy website run by MGH. Has all of these continuing medical education modules that are available to people.
Right.
And so you need to educate yourself. It is all of our responsibility. I'm not trained in reproductive psychiatry, but I made it my business to know the information and then to know the extent of where my knowledge ends and when I need to reach out to one of the reproductive psychiatrists.
Okay. So state line issues. So let's conclude on the logistical part. So, you've got your company, you've been talking about, Mass General having this service. So let's start with Mass General. We'll just go in reverse order. Mm-hmm. So any clinician, and this is for clinicians, so any clinician in the United States can contact that hotline. It doesn't have to be Massachusetts.
No. And often states have their own individual consult lines as well.
Okay.
So there's multiple different resources, but the one run from MGH is anyone can use it.
Okay. Got it. I asked because I'm on Fempower Health. I just redid the website, and now I have by stage of life and by topic a resource page, and it's the episodes, blog posts, and like other resources to click on. So I will be sure to add this.
Thank you so much.
Yeah. And thank you. So then for your company, you had alluded to, Phoenix and was it Tucson?
Yeah, Phoenix and Tucson. That's where our roots are. It's where we started. We are growing we also run a mobile crisis team in Montana and Bozeman.
Okay.
And are expanding services in Montana. We're looking at expanding into other states as well, Washington State, Virginia, and other states as well. But we're doing also a lot of like consultant work. Like we've done consultant work in Kansas.
Okay.
Places like that.
Can you, so have the laws changed yet where it doesn't matter where you practice, patients can contact you from anywhere, or has that not yet changed? I haven't looked recently.
So you to provide services in the state where the patient is located, like where they live on an ongoing basis, you have to be licensed in that state. A growing number of mental health clinicians, psychiatrists included, are getting, with the explosion of telehealth, are being licensed in multiple states to be able to provide those services across state lines. You always have 988, right? That has launched, that people are able to call and access crisis mental health services instead of just having to call 911. 988 will connect you to crisis lines immediately. And the infrastructure of local mental health systems is highly, highly variable. But I think there's a lot of attention now being paid post-pandemic to crisis mental health services. And I think that's why we're expanding so much, is because a lot of local governments are now like, oh my God, we don't have this system developed that we really, really need. So that's why we're going into all of these new, and it's exhausting, like learning all of the local laws that govern and who the players are in the system. And because again, our job is to know the hell out of that system, right?
Yep.
You are the point for everyone where every line connects, and you need to know how to help people navigate it and know where the gaps are that you need to fill. And that is what we do best.
Right.
But there's going to be some semblance of a crisis system wherever you are. It's just often not as well developed as it is.
Yep.
As we are.
Okay. Wow. So we've covered so much, and
been on
holy cow. But it's been like, I think all of it had to be discussed. And I know that, the point of this was to talk about the postpartum psychosis, but I feel like the tie-in with the postpartum depression is so important, so people understand the differences and the normalcy. So I feel like we started off like helping people understand like this stuff happens. And we started with the lighter version and then got into the reality check of how it can be pretty rough.
Yep.
So thank you for flowing with that journey. So what would be like for the patients, family members, and the doctor? I don't know if it's one message or if there's 3 or 2. So I'm going to let you conclude with what the takeaway should be.
I think it's one message. And I think that message is know what to look out for. Know what the potential outcomes are. Pay attention to what's going on with her, and then find ways to support her. The whole system, every single person, we all have to maintain that sense of responsibility for each other, but especially women who have just given birth.
Yeah. No, that's very true. I'm so glad we did this.
Well, I so appreciate you wanting to explore this topic, because again, it really is something that people don't want to talk about.
Yeah.
And people shy away from, but it's so important.
No, I know. And this is the stuff I love to do. So I'm like, bring it on. But thank you. And let's definitely stay in touch.